Boom. All right, let's start it off, man. Will, welcome to the podcast, man. It's great to have you here. If you want to go ahead and introduce yourself, as much as you want to say, as little as you want to say, it's all good, brother.
Michael, what's up, man? Thank you for having me. Hey, my name is Will. I go by Decentralized MD on the Twitterverse. But we'll go with my first name here. But yeah, I'm an internal medicine physician, kind of about a year out of my training, based out of the Southeast, and really have just been enjoying this connecting with people that of like-minded individuals and having great discussions, man.
Nice. So I see you got the laser eye avatar going. Now, how new are you to Bitcoin? When did you discover Bitcoin? What's that been like? What's that process and that journey been like?
Honestly, that's a great question. Bitcoin has been probably one of the most fun journeys of my entire life, I would say. And I'm by no means a veteran. I think I came into it around, it was probably around beginning of residency, so 2018.
Mm-hmm.
And at that time, I wasn't just buying Bitcoin. I just graduated medical school. I was in debt, but I definitely started learning about the technology. And, I started looking towards sort of the big names like Saylor, things like that, and just sort of learning more about it. And I'll never forget, I think it was back in May when he made the official statement with the laser eyes mint, basically about hard money with a good liquidity asset. You're not worried about sort of the fiat mindset. You're not worried about trying to, essentially what I felt like his first initial statement to me being introduced to the low time preference sort of mindset, and as I got more into it, and I just started making small purchases and small trades here and there. And then finally just decided when I joined the sort of the Twitterverse that I was like, I'm gonna go for it. All these guys I really respect have the laser eyes, including yourself, so I was like, I want to feel like I'm a part of something bigger than myself.
Awesome, dude. Yeah. At first I resisted the laser eyes for about half a day. And then I jumped on it and I realized, well, to some extent it's a signal, right? It's a signal out to the world that, there is this group that is laser focused on bringing about sound money. And, I saw it as an opportunity to kind of join in on that. And so, yeah, here we are. And I've been loving your tweets. I've been loving what you got to say. And I was wondering if you could kind of break down kind of your positions, what you view our current state of the world to be, kind of your overall, idea of what's happening. Any angle you want to take it. I mean, we could start off with the current socioeconomic status of the United States. What's your take on that? I'm curious.
Yeah, man, obviously we could talk for hours about this. So I'm just going to be 100% honest. When I started medical school, I got into it because I was really into CrossFit. I wanted to go to medical school because I felt like when I was 18, God called me to become a doctor. I never had anything like that. I was an average student in high school. And I just woke up one day, literally, and had a dream. I was like, I think I'm going to go to medical school. And it was a journey. I got there, I got to medical school, and I loved learning basic sciences. But I didn't, and I just thought it was like we were here to help people. I did notice something strange after I finished the first 2 years. When I got to the third year, which is when you get into clinical medicine, I started noticing the rhetoric would often be, forget everything you learned, this is how we do things, And, you see that on TV shows and all this kind of stuff. But it was just strange. And I was like, what do they mean? What do they mean? And it ended up being, of course, there's like you're told that you go through this process. However, some residents would be like, all right, we're going to take the tangent and get this patient taken care of. There's that route. But then there's also the whole, well, in the real world, people aren't willing to do this. So we just do that. We just do B. Meaning like in the real world, people aren't willing to lose weight, or in the real world, people aren't willing to, do things like myofascial stretching and massage release, things like that. So we just prescribe them pain medicine. And I was just kind of like, well, do we even try? It was just sort of a rude awakening for myself. And I think, and that's the real world as we're coming to know it, but that people, you can't save people from themselves. But I got to residency and I just sort of noticed that no one would question things or use sort of the brain that we trained so hard to have through medical school, despite having hard evidence. Yeah, I mean, and this is when we can take a lesson, specifically like Eastern Europe, where they don't have, the economy doesn't have a ton of money, and they do use more homeopathic therapies that are proven to work, whether that be cheap vitamin D supplements that boost your immune system. Yet you look at the Journal of American Medicine saying, here's why vitamin supplementation is useless. And it's like, what's the point of that other than what seems to be profit driven? I don't know. I still went through the motions, but you and I have talked this term clown world. You kind of feel like, is everyone around me an idiot, or am I just like hyper paranoid? I don't know.
Yeah.
Middle of residency. Oh, go ahead.
Yeah. No, I get that 100%. Especially, I would imagine being surrounded by quote unquote professionals, right? That so many are driven by basic groupthink standards and procedures versus critical thinking. And you start to recognize that, at least I did, that a lot of my peers around me weren't as intelligent as I thought they were. I mean, they were book smart and they could memorize well, but the critical thinking skills, or even having the ability to, just think outside the box, just to explore different paths of doing the same thing, almost seemed to not be there for many people. And that was a big wake-up call for me as well.
Exactly. So I started getting to be around people that I really like to be around. When I was in medical school, I thought I was like, I'm going to be a cardiologist. I love physiology. I love science. When you and I talk, you can tell, like, I like to base my decisions based off what actually, how the body works, like what I think is cool, what I think that the body it's capable of healing itself with. And not just basically personal theory, but actual visible results, tangible results with other things. And, I got to be around what I would consider some of my heroes. And it was like these guys that would say this amazing, statement in regards to some sort of science concept. And the next thing I know, it's like they're chugging their Diet Coke in between patients. And I was like, wow, okay, we're all human. We got to have caffeine. But then all of a sudden it's like COVID happened. And that's when I really saw, the concept never meet your heroes,
Mm-hmm.
That, man, came to fruition 110%. And I can go into that for 2 minutes if you don't mind.
Dude, go ahead.
To provide a few examples, for instance, and this, I hate, as I'm saying this, it is kind of heartbreaking because it was just such a rude awakening. But for instance, when I first saw information being suppressed immediately, like COVID happens, it happens to be at the peak of the Hong Kong protests, in China. And I bring this up and everyone's telling me I'm crazy. I'm like, wait, this is not me sitting here theorizing. I thought this was like a known thing that, we had all these young men protesting for freedom, something I'm a big fan of. Obviously, I've grown up as a staunch libertarian. I've been part of the Young Americans for Liberty in college. And people were just immediately writing me off, telling me I'm crazy. And I was like, this is odd. And then you see immediately how, like, the big tech companies, Facebook, everything, you can't talk about this. You can't talk about it whatsoever. Physicians are being deplatformed when they raise concern or suspicion about what's going on. I talk to leaders that I really look up to in the hospital, and they're immediately saying, you don't think this is some big conspiracy, do you? I'm like, I don't know, but why can't we at least have this conversation? Or the fact that there was evidence that azithromycin and hydroxychloroquine could potentially be an early treatment pretty early on. And I was immediately written off as, oh, you're one of those Alex Jones types. And for the record, I wasn't even like watching Alex Jones at this point. I'd heard of who he was. I didn't even know, like, that statement is what got me watching some of his stuff. And it was just really heartbreaking just to see people just immediately go, well, what does the hospital say? And it's like, we need a quarantine. You can't talk about these issues. We're going to start doing this thing called remdesivir. Everything I saw when I was in the hospital, it doesn't really work, but that's what we're doing right now. I was just like, what? We're not trying to, this isn't about taking care of people. This is about whatever the people up top tell us to do. Being president, I got called out really hard.
So, man, I gotta say, this is scary to think about. It's something I've been thinking about a lot lately, just because both my parents have cancer right now, and so my interaction with the medical system has dramatically increased as of lately, and the the adherence to procedure, despite certain evidence or despite like what the patient wants, is really concerning, right? Like we're shifting
Yes.
more to a collectivist approach to medicine versus a patient first care, to the extent where I've seen videos where a person couldn't get treatment because he was white. But if he had been a minority, he would have been able to get that treatment. And it's the politicization of our medical industry happening in front of our eyes. And it's very scary, at least from my perspective, because this type of thinking is what leads to politically driven medical decisions versus actual scientific data-based medical decisions. Does that?
Yeah, no, 110%. And I think that's what it was, just all these little things added up to finally where I was just fed up. So basically, we're in COVID. Just to give some examples, we're quarantining, we're treating patients all with the exact same protocol. And it all, for the record, like my first exposure to COVID, I was in the ICU on my ICU rotation. And so, of course, I was seeing sort of the people that were coming to ICU to die, because we just, the lungs get hardened up, especially when it was the initial alpha variant. So that was like the deadliest version, right? And we're doing these therapies that's just like absolutely shredding their liver and kidneys. And we just kept doing it to people. The new, COVID transferred from the floor because, their oxygen requirements increasing, they need to be intubated. And we're continuing this antiviral that's just wreaking havoc on their body. So for instance, when all this was going down, my mom got really sick when I was in the ICU. And I was like, I'm pretty sure this is COVID. However, this is at the time when they were only testing the people in the hospital. There wasn't like an outpatient testing thing. And I did everything in my power to keep her out of the hospital. She's like, should I come to the hospital? And I said, absolutely not. At this point now, I'm a second-year resident. I'm pretty well versed in medicine at this point. I had her home. I had a pulse oximeter on her, which basically means something on her finger to monitor her oxygen status. I had found, basically going to different forums, people drinking hot tea, taking azithromycin, and then doing breathing exercises. This was very early on, right? So I got a hold of some, kept monitoring her oxygen, treating her fever, got her drinking hot liquids, and my mom made it through,
Interesting. Why do you think?
Go ahead.
Why do you think that, I guess, more therapeutic approaches weren't taken as opposed to just going directly to ventilators and stuff like that?
And this is exactly what I kept asking, and I was repeatedly silenced. So to be honest, I didn't have an answer either. And honestly, I was terrified because I was like, what's going on? That I was convinced, like someone's trying to hurt us. Someone's trying to kill off the population, like this. Wow. These are the things running through my head. Obviously I'm not saying this out loud, but, I think a lot of people were thinking these things. I think the most recent discussion between Peter Mccullough and Joe Rogan, that was the most clarity I got on the entire situation. Have you seen that episode?
So partially, yeah. I have partial clips, stuff like that, but I get the overall, the overall understanding of what's happening.
Yeah. To summarize it finally, and I think we know what's going on now. As Peter Mccullough said, the most published cardiologist in his field, and his discussion when he was talking with major heads, whether it be in Washington or China, he was repeatedly met with silence for early intervention. It was all about prophylactic, meaning all about like wearing prophylactic gear to prevent the physician from getting sick, and inpatient treatment, meaning what we do once they get to the hospital. And that was my biggest question. I was like, everything I've learned so far is that you always want to keep a patient out of the hospital. Like that is what I learned as a student, as going into, I chose internal medicine because I wanted to work with patients. I wanted to treat pathology. You do what you can because you don't want your patient in the hospital. And, when you get to the hospital, you do what's necessary. However, you work to keep them out. I mean, I think that's a real mindset. And with COVID, it just seemed like we were just completely ignoring that. Oh, you have COVID, go home. And then when you get worse, come to the hospital. And I get really frustrated about the whole situation to this day.
What I'm starting to pick up on is that the culture has drastically changed in the last 2 years in the medical profession. Do you see that in your line of work?
Yes, 110%. It's really interesting you bring that up because, as I started medical school, I was repeatedly told, you guys are the last year of the old way. The last year of the old way. I was like, well, what's the new way going to be? Is it just a new form? Is it a different curriculum? Is it a different way to teach subjects, whatever? And the biggest thing I noticed, especially now, I work in an academic center. I teach students. I teach residents. I've been through a education course. I got my certification in medical education, to be able to teach both basic science and as medical students, to clinical medicine medical students, and to educate residents on how they're training, And there has been a rapid shift from knowing your science, knowing your facts, knowing what the body does, like hardcore, towards this more, if I'm being 100% honest, there's been a rapid shift towards more have an idea of that, but really, it's more, there's been this incredible new multiple hours added on focus of what I would consider social equity almost, but a lot more like, healthcare disparities, which those exist and you have to address them. But, now there's, different. And again, everyone has their own experience in life. I being a, sort of northeastern European descent, Caucasian male, obviously, it's hard for me to comment on some of these things, but, a lot more like color representation in medical schools, making sure that it's not really about their board scores. It's about where they came from, or it's just been very interesting to see something like this, not about merit, but, certain attributes of a person that they can't really control. So.
Wow. So we might have a doctor treating us that is there not because she's the best in her field or he's the best in the field, but it might be because the color of her skin or because the sexual orientation even, or the gender. So is that what you're saying? It's like these attributes.
Yeah. I'll never forget, because I saw a student, I would tutor the first and second years. I was very excited because I was a very average student in high school. I worked really hard in college, but I didn't get into medical school my first 2 tries. So I got to medical school, I was ready. I had a 4.0 my first 2 years. So I tutored a lot of the first and second years. And I remember being like, okay, let's go over pathology. And they'd be like, yeah, but can we cut it short? I've got to study for my gender studies understanding lecture tomorrow, because I'm giving a presentation on transitioning, how I talk to pediatric patients about transitioning from female to male or male to female. And I was like, wait, what? And I find out our hospital just started a big transitioning clinic, and then they just fired one of the best psychiatrists I'd ever worked with. And I was just kind of like, what is happening right now?
Wow. And I would imagine they fired a psychiatrist because she or he probably had a stance that was different, that maybe we shouldn't be encouraging people to transition, that maybe we should focus on reorienting them psychologically to be in alignment with their biology rather than, going through very invasive medical procedures. I'm just guessing here, but
no, yeah. So it was one of those things where he took a stance of, why are we putting all this money into starting a new transitioning program with whether it be adult or pediatric population. That's already it's very controversial in itself, right? But also, though, we already mental health is so underserved, specifically in the Southeast. already, and like we should focus on maybe having better facilities to maybe, for all the psychiatric patients, we're always at maximum capacity. And he raises these concerns, and next thing I know, he's no longer at the hospital.
Okay, gotcha. So
yeah, I was just like, what?
Yeah, so this is scary. And this is a lot of what I've been talking about lately, and it's what I see as woke Marxism, right? Woke identity Marxism, basically making its march through the institutions, and now it's going through the medical profession, and it's happening at a rapid pace like we've never seen before. Primarily because a lot of these young people coming up have been groomed for this their entire educational lives. And there's been nothing there to confront these really radical ideas from serving as the basis of their reality. And yeah, it's scary to me because in something like medicine, where you really want objective people who are making the best decisions possible, who have been put in place because they have shown extreme competence, we now are moving towards a system where it's identity-based hiring, and where it's no longer based on competence, and decisions are made based on your identity. And this is all, man, this is all scary. I can't believe that we're even, and I feel like it might become a liability to even go to a hospital,
It certainly, it can feel that way. Granted, there's always a place where patients can be taken care of. I have to say that. Like, I work very hard to advocate for my patients. And I feel like I've had some great successes in my career. However, yeah, I'm concerned. I think the biggest thing that I'm noticing is that these kids aren't questioning the guidelines. They're not questioning the criteria. They're not questioning why we do things. And that was some of my guys that trained me. The biggest thing, and that was always my comment, was like, Will works really hard to know exactly why he's doing it. And if a treatment doesn't quite meet the needs of the patient, he tailors the regimen because he realizes how to personalize healthcare. And that was something that statement lives with me to this day. That's what I take pride in. It's because that's why I became a doctor, not a mid-level provider, meaning like a nurse practitioner, which there's nothing wrong with. You go to school for 2 years of nursing school and then a year of nurse practitioner school to be able to run algorithms and treat not as severe diseases, so you can take care of people, especially in underserved areas. But I became a doctor because I learned everything about the body. I learned body, what I call before sin, after sin, meaning like how it should work and what can go wrong. And then how we have all these regimens and treatments, and we base it off evidence of outcome, but we also know that everyone's different, right? So what might work for your mom wouldn't work for my mom, right? And that's the beauty of it. So I can tailor that regimen because as a physician, I have trained that long. I've been certified in internal medicine so that I can make those personal decisions because, they put me in that position to do so, right? But man, it's just like now we're no longer questioning it. And it really, I just saw that come to fruition because I would have my colleagues or students or residents be like, well, Dr. Fauci said. I'm like, okay, are we not realizing that this guy keeps changing his opinion like every 2 months and everyone's just like going with it? What about
that? And it seems very top-down driven, right?
Yes, 100%.
Yeah. And the top seems to be corrupt, seems to be dishonest, unethical in many ways. And that's a problem, right? When you're getting your orders from the top and they're coming down as policies and people are following them unquestionably. And that's one of my main concerns with the medical profession right now. But
understandably. And that's why I try to be transparent with people. I've certainly gotten reprimanded a few different times, but luckily, I think my results and my documentation and what my patients always is reviews or whatever. I think that's why they have a hard time trying to get rid of me because I'm never coming from a place of I want to tear this place down. I'm coming from a place of I want to take care of these people. And if my friends, parents, or anybody, I like to always be someone that helps coordinate care because I don't know. I've been a patient before too, and I've been there, and it sucks. And I know what the system is capable of. So I try to help people navigate and avoid, the ridiculousness that we're going through.
Are there good doctors? I mean, in your experience, are there doctors out there who are trying to do the right thing, who are trying to push back against this, and who are trying to go back towards a more, I don't know what you would call it. Would you call it a more patient first kind of approach to medicine?
That's so it's funny, how you talk about woke Marxism.
Mm-hmm.
I would say what I've learned about that is really weaponizing language, especially in the medical field, because they call it, we're moving towards patient-centered care. And like everything I've learned now is basically that's a big statement to say we're moving towards whatever I say from the top, whatever the administration says goes, whatever the insurance company covers goes. Except you just have to be the doctor that tells them, not anyone else. You have to be the one that tells them, well, we're not going to do that. You have to be the one that tells them, well, we don't do things this way, or, well, I understand your request, but I'm not going to do that. That's what it seems to mean at this point. And I'm speaking from an area of frustration. I certainly can attest to, I know some fantastic physicians that are within the system that don't make things said verbally about how they feel, but they let their actions show it by what they do for their patients. If that makes sense.
Yeah, that makes sense. So, man, and what is your sense for the future of medicine? Like, where do you see this going?
To be honest, this is what kind of brings us back to Bitcoin. I personally, you and I can sort of think about some of our other conversations we've had. I think that as many doctors as I've seen that are getting frustrated with the current situation, I think that there will always be establishment medicine, but I'm not going to be shocked if there's this big fork in the road. I'm not going to be shocked if, we start moving towards a more, what's the term for it? Operating outside of insurance, going to more personalized care. I think functional medicine doctors are going to become a much more crucial component to the patient population. Have you ever heard, for those who don't know, functional medicine it's acknowledged by the American Medical Association and things like that. However, it's not considered like one of the official practices of medicine. It's definitely what they would call a fringe area, because you kind of go and the whole basis of that specialty, which is a fellowship after medicine, after family medicine, or for a fellowship meaning extra training after your residency. It focuses on the body healing itself. For instance, if you came to me and said my joints are hurting, as a internal medicine doctor, standard of care in the academic center, it would be, well, we need to put you on scheduled Tylenol. We need to see if you have, get some x-rays of your knees if they're hurting. And we'll kind of go from there. And if that doesn't work, we'll start moving towards maybe some knee injections or something like that, right? And in the functional medicine world, it goes, well, tell me about your diet. Well, what's your sleep pattern like? Do you have any history? What's your family history? Any history of autoimmune disorders? And then I would run a panel. Maybe you can check your vitamin D level. I might check your thyroid. I might check, it's definitely a lot more like what's the body missing to replace, and nutrient wise, what are the habits that might be missing to allow the body to heal itself?
So I would call that maybe a more holistic approach where we're
right.
Okay.
One would think that's just what a doctor would do there, right? I think, but unfortunately, I think as I'm saying it out loud, I think that's my biggest concern, is that there's a fellowship to practice what I consider normal medicine for people, but it's considered fringe or holistic medicine. But I mean, it seems pretty reasonable though,
Yeah. And I think there's a big awakening towards that, at least from people themselves, right? I think, and it might have started from, dieting and getting back to, hey, what have our bodies evolved to eat versus what are we eating now, and recognizing there's a big disparity there. And so people have kind of reverted back towards eating, I guess, meat and raw vegetables. And you just take that kind of mindset and you start applying it to your illnesses. And, for a lot of people, I think they've recognized that the way we live actually has a big impact on the way we feel.
Right.
Like it makes sense.
I spend a lot of my time outside of work, whether I'm, being with my family or studying Bitcoin, studying how to, I think you and I both know, opt out, trying to do more, basically avoid all big tech and trying to embrace sort of open source software. the biggest thing I also focus on is what's called functional medicine, like we just said. I'm actually on the side doing like personal training to one day be certified in it. I have no tentative plans right now to end up being like a practicing functional medicine doctor. I just like to have that knowledge, and I want to be able to provide it to my friends and family, and then kind of go from there. But yeah, I think, the biggest thing to really dive into this, understanding things like the fact that the Rockefeller Association back in I think it was the 20s or 30s, lobbied against homeopathic therapies. That's why and that was sort of the big rise of big pharma. I learned that, and like, that makes complete sense now that I really see the demonization of supplementation with cheap, affordable supplements like vitamin D, like B12, like doing things like quercetin. Like, I'll never forget that quercetin, taking it 3 times a day, a cheap supplement was showing to open, expand the lungs. However, all of a sudden, in the peak of COVID, when I think it was like different Eastern European studies showed that, hey, daily quercetin can really combat this. All of a sudden, Amazon's no longer selling it.
This is one of the things that Dana White said, right? He was like, man, it's wild because all of this stuff was readily available beforehand. And it's just, as soon as people started figuring out that it helps them with their COVID treatment, all of a sudden you can't get it anywhere, right? They won't sell it to you. It's wild.
Exactly. And it pissed me off so much because I'll never forget. I saw the evidence for azithromycin, hydroxychloroquine. Again, somewhat controversial. However, things are going to be not incredibly tested in a pandemic, right? And we're talking about early treatment, not about being in the hospital. And I tried to write a prescription for the Plaquenil or hydroxychloroquine, and all of a sudden I get a flag and a phone call.
And these are things that have been out
for years, like tens of years,
and are used for other illnesses. And
oh yeah, we have what's called off-label treatment. I mean, and I think you can watch that Peter Mccullough. I did off-label treatment, especially my intern year before COVID. I was always using different medicines at lower dosages to treat certain things. For instance, I had a young man who had a horrible motor vehicle collision when he was 18. Mm-hmm. And he was really messed up. He had completely recovered since then, but he suffers from like chronic pain. Mm-hmm. And I think at this point he's like 27, came to my clinic. And essentially that time it was like, I could tell the pain was really getting to him. That we actually have, but he was like, I don't want to be on pain medicine. I was like, I totally respect that. Here's what we can do. And I walked him through a bunch of different, what I call, it's called, the therapy is called Graston. It's something they're using in the physical therapy world. There's a book called Supple Leopard by Kelly Starrett. It's fantastic. Physiotherapist, physical therapist, basically learning how like we should start considering like the soft tissue, meaning like the cartilage, a whole other organ in itself. And doing certain stretches, mobilizing tissue really helps like the body overall in terms of circulation, overall pain. I educated him on that. I had him follow up with me every 2 weeks, and I started him on a very low dose of an antidepressant that in studies had shown also treated pain really well. Because I could tell he was having an anxious depressive component, not full blown, and he was also having bad nerve pain. And so this really cheap alternative at a lower dose, all of a sudden I had him on it consistently for 6 weeks, and he thought, and it was like I changed his life. Right? So it's off-label treatment. He didn't meet the criteria for major depressive disorder. He didn't meet the criteria for what we call neuropathy or nerve pain. He was just basically chronic pain from a motor vehicle collision, right? So I did off-label use of this one type of antidepressant, changed his life, right? That's what we call off-label use.
Interesting. And so that's been a standard medical practice, right? To do off-label use.
I mean, off-label, like there are things like these things that are called tricyclic antidepressants. They're kind of old, mm-hmm. but they have certain effects on like our gut and bladder. And so you can use a much lower dosage, like significantly lower dosage for either elderly or children. That's like minimally, like there's no side effects, but it'll treat things like people that suffer from bedwetting, mm-hmm. right? So it's like an antidepressant, but at a low dose, and the way its mechanism works, it can help them sort of get through either whether you're older and you're wetting the bed or you're a kid and you're just having a significant difficult time with that, it can treat that process and help get you through it, right? But that's just an off-label use. I mean, off-label is standard. I learned all about that in medical school, right? You have a drug for one thing, but it turns out it works for this, kind of like Viagra. At first it was used for heart issues, and all of a sudden, and it was in the military being as a trial, and all these military guys kept coming back for more pills, and they're like, wait, what? Why are they coming back? It's like, turns out it really helped them sexually, right?
Interesting. Now, can I just want to point out, and maybe you can tell me if my thinking is correct or not, but so this type of hostility towards, I guess, off-label use and um, patient-focused care uh, seems to be revealing an establishment, right, and a hierarchy of power. Um,
Yes.
and now, I guess what you're saying here is the result of this is going to be kind of like establishment medicine, where patients go in there and they go into the medical system and they're treated based on policy and procedure, versus a parallel medical system being built out that has a much more holistic approach to treating patients. Is that kind of now the future that you see happening?
Personally, yes. You know, I think what's really difficult about the whole situation is that I think you talk to half of the physicians and they would say that doesn't exist at all. Or they would say, we personalize everybody's healthcare. There's this big veil of we're doing this personalized approach, yada, yada, yada. Yet, I mean, if it's personalized approach, then why all of a sudden our insurance companies say it doesn't meet exact criteria based on a book that somebody wrote in Washington in communication with an insurance company? So they're not going to cover that medicine. I'm like, what's personalized about that? You know what I mean?
Exactly. And then also we could just look at it with the vaccines, how there's this one size fits all approach, a very collectivist approach where, I hear horror stories, whether it be people reaching out to me or, you'll see videos of people basically pleading that, hey, my husband had an adverse reaction to the vaccine and they still want him to go get his second dose and get his booster, even though he has myocarditis and the next dose could potentially kill him. And to me, that signifies, hey, um, we have now moved towards a different route of medicine, and it's actually now not so much personal care, but it is more of this collectivist approach. What's good for the herd is good, is good for society versus what's good for the
Exactly.
individual.
That is what. Oh man, that is why you and I are having this discussion today. Was I always kind of in the background followed Twitterverse, man, but you came in hard with the gas on some amazing just sort of insight, and I finally was like, you know what, I'm going to start saying something. This is ridiculous. The vaccine, I think, was the last straw for me because, and for the record, before this, I'm not anti-vaccine. I mean, I've taken the flu shot every year as a part of the hospital standard of care. Thought it was a very reasonable thing. However, learning about this vaccine and what came with it, I'll be honest. Initially, I was like, "Oh, great, maybe this will help." I immediately saw that it didn't. I think that's what blew me away was, I mean, we had one lady come in after getting the shot, first dose, and her arm literally was rotting off, and we had to cut her arm off. Surgery had to come in and remove her arm because she had what's called myonecrosis, which means complete muscle death. Basically, the arm was unviable. She had to have an amputation of her arm, and it was like no one discussed sort of the concerns of this.
And so, what do doctors say then? Because obviously they're getting mixed signals, right? They're being told by the establishment, by the top, I guess you could say, right, of the
Right.
medical establishment that, hey, this works, this is safe, and this is effective. And when they're actually in the field working, I'm sure they see conflicting information. And do they just deal with that cognitive dissonance? Do they just ignore it and just kind of brush it off and just continue on with their job, even though they know that what is coming from the top isn't all that trustworthy or true?
So, and that's a great question. So, what I've learned now is that, I want to believe that people, it would make sense to have an all encompassing plan. And I do think, I personally believe that there's evil intent. I think that the people that are advocating for the vaccine, at least a majority of them, think that the data is sound. But I have also learned about what we call biostatistics, which is how you interpret these papers that are evidence-based medicine, right? What I have learned is that a majority of physicians just read the conclusion on a paper. So if the paper says, and come with this research, the conclusion shows that this works or this is better, and I was like, I really started learning about biostatistics. I bought a course online and went through it hard so that I could truly interpret papers, understanding the different definitions of all-cause mortality. And we learn about these things in medical school, but you don't practice it a ton. So I really wanted to be well-versed in it. And I started seeing discrepancies. Like I'll never forget when ACOG, this will be a controversial statement, but ACOG, basically this OBGYN association, came out and said the vaccine was safe for all pregnant women. However, like you look at the inclusion criteria and the exclusionary criteria and saying like, oh, it's safe. And then they excluded all these women that had miscarriages, just to state it plainly.
That's incredible.
Like,
let me tell you, this type of deception, I would call it, these games that are being played with the data. Actually, I want to go into that because you had a tweet about that. Can we go into that a little bit?
Absolutely.
Let me pull up that tweet. Do you remember it offhand?
Oh yeah. Absolutely. So
actually, I got it right here. Let me read it, and then we can dive into that a little bit. So, hard truths I've learned since graduating medical school 3.5 years ago. Statistics can be easily manipulated. Optics are valued more than real solutions. Absolute truth doesn't matter if it isn't profitable. Man, those are some big statements. And yeah, I commented. I thanked you for just saying that out loud, because I think that we all feel it. We all sense it. But yet it seems like the medical profession is silent about it. And so if we can just dive into that, I think we've got already kind of touched into how statistics can be easily manipulated, but you want to go into that a little bit more?
Yeah, absolutely. So the biggest thing too, and I'll never forget, this is when I first started, this was before COVID. This is when I started questioning statistics. Because for instance, we have guidelines for blood pressure. We focus so hard on blood pressure and blood pressure treatment because, evidence would show, and I think blood pressure is a component of health. The lower the blood pressure, the better, right? But we obviously, we don't talk about inflammation, which I think is the core root of a lot of problems. However, blood pressure itself, to me, treating blood pressure is like treating a symptom, not a cause a lot of the times. However, so basically what seems to be happening in the blood pressure realm is that they continue to lower the standards or lower the values of what's considered high blood pressure. Like to a point now where like, I think the most recent one now says like 125 over 75 is considered high blood pressure. And I'm like, what? Like anyone can measure that at any time. It felt like continue lowering the values into healthy ranges. All of a sudden gets more people on medicine, it gets more people on medicine. And I was just really concerned. Now, granted, I do have to preface this with, we are getting way less healthier as a population. It's a problem in itself that has everything to do with food disparities and making horrible food cheap and good food expensive. So there's a lot of things to that. But blood pressure is often a symptom and not an organic disease, and I think it has a lot to do with just the inflammation from the horrible foods that we're exposed to, from, what they consider to be safe and healthy water that is often not. Anyway, that's a whole nother conversation, but yeah, and then I really started delving in. That's when my first concern, I really started learning biostatistics, and I really started examining what the data showed on this vaccine, obviously, because that's a majority of the questions I'm getting, especially from my family. And I was like, to be honest, if I'm looking at the data without looking at the conclusion, it looks like the vaccine is equivocal. It looks, if anything, the complications, what they consider, and that was another thing, is that often in the papers, what they considered mild symptoms, some would argue, are just as bad as getting COVID. You know what I mean? So it's all about what they consider, what the paper is qualifying as side effects or risk versus benefit. And it's all about modifying or massaging the language, in my personal opinion, right? So it's like, a side effect of fatigue. And it's like, okay, fatigue for a day or fatigue from then on out, because you have spike protein elevations causing horrible systemic inflammation, causing severe joint pain and, what about these new tremors that we're talking about? And it's like, oh, mild tremor. In my personal opinion, a mild tremor from someone that's never had a tremor in their life, to me, is a big deal, right? So it's all about the language of these things. And so statistics come into play. You can have the values there, but if you're qualifying data or your language using what you describe as side effects or possible outcomes can be tailored to say, we don't personally think this is bad. However, the patient who doesn't understand how to quite interpret what a doctor means versus the real world outcome of that, that can be totally interpreted differently. I personally think that there's no such thing as a mild case of myocarditis. A kid getting myocarditis and not having to be able to, when it's so crucial for children to play outside and be active, and all of a sudden we start talking about mild myocarditis treated with high-dose NSAIDs, which already, high-dose NSAIDs, yes, treats myocarditis, but it also significantly affects your kidney function. It can cause high blood pressure. It can cause all these other problems. And the kid now can't be physically active for 6 to 12 months. To me, that's a big deal.
And not only that, but if I remember correctly, and this is just off the top of my head, but there's a strong possibility of death within like 5 years, right? Like I think it's like 40%, 50%.
It's very concerning. The VAERS reports are quite alarming on this vaccine. You always have to account for some hysteria, absolutely. Understandable hysteria, though, obviously. And then you have to account for, it being early. But yeah, and that was another thing that was really concerning to me, specifically in the initial trials that Mccullough was talking about on all the studies, which he quotes and cites and are all available. They're seeing an unexplained death within 14 days after, specifically in the elderly population. And now it's like, pending these side effects, these mild side effects that could potentially last forever, certainly increase your risk of mortality, meaning death. So it's like, is the vaccine directly going to cause death in 4 years? I can't say that, but I certainly can say that lowering your quality of life, putting you at higher risk for a more sedentary lifestyle that could then exacerbate your ongoing chronic medical problems. Yeah. So that's why it's so easy to demonize, I feel like, physicians who speak out against them, because it's hard to have a platform for 4 hours explaining the nuance of multifactorial problems. All they say is, they say the vaccine kills people in 4 years. These people are totally wrong. Yes, in a sense, they're technically wrong. But how else are they going to get out on a platform for 3 minutes and explain that?
Yeah, it's like soundbite medicine, right? It's like
exactly.
These things are so. And this is why I appreciate what Joe Rogan has done, getting Dr. Mccullough on and Dr. Malone, is because with that type of broadcast or that type of platform or framework, you can have these in-depth conversations and really explore these topics thoroughly to get a really thorough understanding of the nuances of all of this versus what we hear on CNN or these network news channels, where it's all it's all about catastrophizing
yes,
everything, and then offering the solution as this one simple approach. And when we all know intuitively that that's not how life works, and definitely that's not how medicine works, right? Everyone has different reactions to different medicines, and depending on their body chemistry, and I would imagine a whole host of other factors. And it's crazy what they want us to believe. It's crazy the thought process they want us to accept. It's almost like they want us not to actually question anything and just take their word from it. And if you're asking me, I don't think they're trustworthy at all. And and that's the approach I take. So yeah, I'm really grateful for people like Joe Rogan giving these doctors a platform. And I'm curious, and I'm grateful for you. I mean, even right now, speaking to me, we need more doctors talking about this stuff. And my question to you now is, are more doctors speaking up? Do you see that happening? Or
I do.
Okay.
Yeah, no, I personally do. Now, granted, and it could just be within my local circle of friends. A lot of us aren't just I've never been super active on a social media platform, until now, until I felt like it was necessary.
Mm-hmm.
But yeah, locally, Yes, they are. People are waking up. It is quite refreshing. My only concern is, this is a whole nother conversation, but my only concern is that we're all waking up way too late into the game,
That we're too far gone, that the medical establishment isn't salvageable at this point? Is that?
It would, yes, basically. I feel like it would almost, and I hope I'm proven wrong personally, but if you're asking me my optics, personal optics and what I'm seeing, it's amazing to see people waking up. It's amazing to see people advocate for patients and say, okay, like I've never recommended the vaccine to any of my patients. However, also, and that's not just a standpoint of, I never recommended the vaccine. I was initially curious about the vaccine, but then also I felt like it was wrong to recommend an experimental therapy because no one knew. We were told to offer it, and whenever patients inquired about it, I certainly explained what we understood and said, hey, yeah, it's up to you.
And the waters were muddy, right? Like I didn't know whether this was, not that it would matter to me personally, but like I would imagine for a person trying to really understand, the status of this vaccine, there's all types of conflicting information, whether this is approved by the FDA or whether it isn't. The media says it is. This doctor says it isn't. And I would imagine if you're giving like a professional opinion on it, you need some solid ground to stand on. And it just didn't seem like there was any solid ground to stand on at the beginning of all of this.
Absolutely. I know. I mean, and coming from someone that, I've certainly never been, I wasn't just, I don't know, coming from somebody that I guess had faith in the medical system initially. I had my doubts, but I still embraced it and I still tried to do what I thought was the right thing. Immediately when we had people not really having much to stand on, but yet completely saying this is the absolute truth and obvious suppression of any dissent, that was my immediate red flag. I was like, something's going on here. That was a big wake up call for me. And, Lord willing, it was on purpose for me. And I'm glad because it's opened my eyes to a lot of things. It's opened my eyes to better protect my family. And it's to better help others, to help advocate for people that deserve it, and that don't deserve it. We're called to be men. We're called to do the things that we feel are right. And I'm following what I feel is, God put on my heart.
Now, I didn't know what to expect during this podcast. I didn't know how far in depth you wanted to go. I didn't know how much you wanted to speak about the medical profession or what's happening there. So I'm curious, how do you approach this? I mean, are you concerned about your job? Are you concerned about speaking out? What's your philosophy there? What's your thought process?
Yeah, no, that's a great question. I am concerned about speaking on a public platform, plus or minus on it. Just because what we're seeing about people immediately, like people losing their license, people attacking their license. And it's funny because it's usually not the employer themselves. It's the mob, that you see that, I can't tell you how many times I've seen now people say one thing that honestly, like they usually align with everything else that this mob-like mentality is saying, except for one thing. And they have powerful people in these groups because they're going after, they don't go specifically after them. They go after, they follow the money. They go after the person that employs them or the person that endorses them. And, it's wild what we're seeing. It feels it's a professional attempt. What it seems like there's obvious intent to hurt any dissent. And so as far as my future in medicine, so to be honest, that's why I'm spending a lot of time educating myself on functional medicine. I'm trying to advocate for patients. And honestly, I'm navigating this process as I go. I'm not quite sure. I'm going to continue to treat patients the best of my ability. I'm going to continue to try to coordinate the care for people and my family and my friends. And whenever they have questions, I'm going to try to help them have the best outcomes. I do think there's room for medicine to help people, but obviously the big inhibitor at this point is the leaders that we have. And I'm hoping as more people wake up, maybe we see a change. However, if we don't, there's enough people that are willing to do a hard fork. And I think that's where, sound money and Bitcoin offers that opportunity.
Yeah, absolutely. It offers an opportunity to build out a parallel economy, a parallel system, and one that's based more on truth and merit versus pandering to the political establishment.
Absolutely.
And I would imagine that, you know, you're facing a situation where you could be possibly in the future doing things which you feel unethical if things continue to go down this route,
Yes.
right?
Yes. And I'm fully prepared to die on that hill if they want me to do things I don't agree with, and it's my career. You know, the only thing I fear at this point is God, you know, and I say at this point, I've always been a God fearing man, but, you know, if you're going to call me to be a worker of iniquity, I refuse, you know? And so I have to be a role model and a leader for my children, for my wife. So whatever the outcome, I'm going to do what I feel is laid on my heart. And if that involves me being, you know, booted from the system, then it's just another opportunity to start something beautiful. So.
Absolutely. I feel like, you know, if more people just committed to aligning their actions, their, you know, their daily actions, their relationships, with what they believe to be, you know, morally conscious behavior, it would do a lot. You know, it would do a lot if people just live by their principles. And
yeah, I think we see that with the truckers protest, right? I mean, all it takes is the people. It takes discussion. It takes dialogue, right? Like you and I having this conversation, right? This is discouraged, and all we're doing is having an educated discussion, right? It's us. The government should fear us. They work for us, right? And I think that's probably been, if not one of the most frustrating components of this entire thing, is that, guys, we are in charge and we can do this. Like, we just have to, you know, if it's coming from a place of goodwill, good always triumphs evil.
Yeah. It's weird because I feel like so many people have trusted the system, have trusted the institutions, to the point where they've never worked the muscle to resist, or to even think for themselves. I mean, they've been on this program where they just operate based on a structure, and now that structure turns out to be corrupt, or turns out to be not as dependable as originally thought. And it's like you have to go back to the drawing board and start from scratch almost. And that's daunting for a lot of people, especially if you consider the day-to-day responsibilities that they have. I could see how people just acquiesce and go along with the program. But the problem with that is, you know, if history shows us anything, it shows us where this type of thinking leads to. And we live in a time right now where, you know, your character is being revealed, and we all got to do hard things in order to turn this ship around in a way. You know?
Yeah. Hey man, weak men create hard times, but you know what? It's going to be a beautiful thing, because I think what's going to rise from the ashes will be something that has been needed for a long time.
Yeah, you know, and this is where I think that Bitcoin is going to emerge as the selling point, right? As a point where all of this awakening, the energy from this mass awakening, kind of gravitates towards. And that's what I'm seeing. And then if we look at it right now, it does offer us an opportunity to actually say, hey, the way we're going is wrong, and we're going to go a different route, and we're going to use Bitcoin to do so, because this is a way for us to connect and interact with each other on a very honest, in a very honest way, right?
Yes.
Because, you know, it's limited in supply, no one controls it, everything's transparent, we know the rules. This isn't a system where the powers that be, the establishment and so forth, have unlimited access to capital, and therefore can tilt the scales in a way that gives them, you know, unfounded power. And now we have a way to, you know, bypass that and say, hey, no, we're not going to play that game any longer. And I think that that's going to permeate through all the really important aspects of our lives. For instance, like the medical profession, but you know, it's going to expand beyond that to everything. And so I really see it as a way to escape a lot of these policies that are being handed down.
I could not agree more. I think we talked about this in the past, but and for whoever's listening, I think Bitcoin, what's so beautiful about it is that, the principles that it stated to have from the beginning, and then the adage of fix the money, fix the world. And I was kind of like, that sounds good. I really just was interested in sort of, sound money, hard money, right? But because we're all aware of the inflation rate, that's what I got more concerned. However, now Bitcoin has become such a beautiful thing in terms of it becomes an opener to have the conversations to point out what I consider, the evils of the world, because you point something out that's so factually true in terms of the corruption of money in our government. And that opens the door to talk about sort of those, hot topics or whatever. It does open the door for whether it be, wokeism in medicine, or because you can say a lot, because, I think we can delve into this, but a lot of the root of our problems, or a lot of the root of movements, is money, whether it be, George Soros's movement to, be soft on crime with all these DAs, right? Or something like that. It's just, it all seems to trace back to money. And Bitcoin offers a conversation where you can talk to someone maybe from a different background and address your concerns that might be, a hotbed topic. But you start with the opening with the Bitcoin, things like, the Bitcoin Standard, Creature from Jekyll Island, The Price of Tomorrow, these fantastic reads. And that really does sort of open the avenue to have these discussions about, well, is mass spread mandated medical procedures an ethical thing? How is that ethical if what we're doing to people, middle class families, ethical, right? It sort of opens that door without coming in at somebody. Because if you start on these other topics, I have found now that I'm trying to have these conversations, is that if I start with Bitcoin, I'm immediately given sort of I'm given a chance when I start discussing more controversial issues, right? If I just come in and say China's trying to kill us, blah, 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 it's like I'm a conspiracy theorist, right? But if I come in and say hey, yeah, Bitcoin, it's great, it's hard money, it's allowing people our generation can have a chance for generational wealth again and everything like that. And I go, well, how is that? And you go, we look at the properties of money. And then, you start there. And then it sort of opens these forums with people all from different backgrounds. And all of a sudden they hear you when you start addressing other concerns, because it relates back to the corruption of money. So that's just that's my personal just excitement about Bitcoin too, is that it really does open a door for beautiful conversations that are normalizing things that they used to do back even in the 90s. We could have these conversations without anyone giving a thought to it. Right.
Yeah. So I think you said two important things there, right? So number one, you can approach these topics from a position of positivity. Like, hey, look at this tool. It's going to change. It can possibly change the way we live our lives. It gives us an opportunity to save the value of our labor. It gives us an opportunity to connect with one another on an economic basis. It's open, it's inclusive. And again, that gets the conversation started from a position of positivity versus a position of doom, And so people are a lot more receptive to that type of information. And then the second thing is, once they start to understand Bitcoin, I feel like the preconceived notions that they had about the way the world works, I think that comes into question. And so that already starts the humbling process where they say, oh, wow, I was wrong on this, or, hey, I didn't know that worked this way. It's very interesting. How else does the world work, And it opens them up to now questioning things a lot more. And I think that's the beauty of Bitcoin. It is kind of like the gateway towards red pilling someone,
Yeah, absolutely. And I think it's just so funny because once I kind of realized that, I've been going pretty hard on that, with my residents, with my, and I always, I try to intentionally let them see me reading about Bitcoin or something like that, just so it feels like they asked me the question,
Mm-hmm.
And that's where I start, and being an attending now, I'll say fun assignment. You don't have to do this. However, it would be great if you did. I always just say give, and I keep a few copies of the Bitcoin Standard in my office. I'll hand it out to them,
Nice.
and just be just tell me what you think about this. Tell me, or I've even the other, as I've been reading the Fiat Standard, which has been fantastic. Certain excerpts from that, I'll just be what do you think about this? This is from a well-versed economist, right? So it's just once you get, again, yeah, like they're like, whoa, and also I think the beauty of those books is that they're made for the common man. And then once you kind of read those, it's hard to unlearn that knowledge. And you immediately see like the sort of agenda, specifically in the news, like about, war is money, right? It opens their mind, and all of a sudden they're like, well, what else? And the floor is totally open at that point, and it's a beautiful thing.
Yeah, definitely is. Man, listen, this was a great conversation. Is there anything specifically else that you want to cover? Because I feel like it's a good point to close it off. But if there's something you want to dive into, happy to go there as well.
No, man, I'd just like to say that, Michael, what you're doing is it's awesome. You had an effect on me way before we knew each other, and I'm honored to have a friendship with you. And I hope we continue to grow, and maybe one day down the road we'll be working even closer together. So.
Dude, I appreciate that. Yeah, I got to say, it's been great to connect. Twitter has been amazing in that way, that like-minded individuals can find each other, and that creates a synergistic effect, man. And I really appreciate what you're doing, very much so. Taking the risk, putting yourself out there, and talking about very important issues that need to be spoken about, and lending credibility to it from a very professional place. And I just want to say thanks for coming on. And yeah, looking forward to further conversations and discussions, man.
Yeah, man. Absolutely, dude.
So just to finish it off, they can find you on Twitter at Decentralized MD. And is there anything else you want to add to that, or is that pretty much?
Oh yeah, no, I love discussion. I've even had people reach out to me for quote unquote advice. I'll say in the standard, I don't provide like classic by the book standard medical advice. I give my own opinions in that context of being on Twitter. However, any DMs I always answer. And my recommendation would be look at who I follow, because those guys are totally influencing the world.
All right. Thanks, Will. I appreciate you coming on. I'm going to end the broadcast, and then we'll have a little chat afterwards. How's that?
All right, man. Sounds good.